Hello and welcome to It's a Code U, mental health support for those working in healthcare. This is a podcast created for healthcare employees to explore not only issues relating to mental and emotional health, but also unique challenges that those working in healthcare are faced with. Your hosts are Adina Tucker, a licensed clinical social worker with Dartmouth Health, and Jennifer Hinsey, an MSW also with Dartmouth Health. Hello and welcome to It's a Code U, and we are starting the new year with more topics on mindfulness. And today we have Stephanie Chesnut here with us, who is a licensed marriage and family therapist and a therapist here at DHBHS. And we've had her a couple of times, so we're excited to have her back. And she is going to talk to us about guided meditation. I know I've not used it a ton because I don't like a lot of the voices, but Stephanie has a very nice voice. And I actually really like the guided meditations that she's made herself. So we are going to actually talk about it, learn about what it can do for you, how does it work, and then also play one. And then Jennifer and I will give you our reactions to what our experience was like. So I'll let Jennifer kick us off.
Thank you. And Stephanie, thank you so much for being with us today. And yes, you have the smoothest, most comforting guided meditation voice I have come across. So I really enjoyed it. All right, so let's get to the basics. Can you just tell us a bit about what is guided meditation?
Sure. Well, thank you both for your compliments. I appreciate that. As a side note, tangential, I don't know if I ever told you in one of my previous lives, I was a radio DJ. So that was one of my skills there. So glad to be able to use it in this way as well. So guided meditation is just a form of meditation where somebody is leading you through it. So whether that's a teacher, a narrator, a recorded voice, it's designed to help you relax, focus, or work on something specific. And it's really about having a guide. So I got into guided meditation myself because it's what I prefer when I think about various forms of meditation, which are often recommended as a complement to mental health treatment. And for me, I found that like when I was doing things that were just mindfulness meditation of being present in the moment and observing like your thoughts and feelings and stuff, that was really hard for me. I just would find my mind wandering to what's my grocery list? And then, no, I got to bring it back to being in the moment. No, in the moment, I'm thinking about my grocery list. This is not helpful. Oh, wait, I'm doing mindfulness wrong, which is not helpful when you're trying to be mindful. So for me, out of all the forms, the guided meditation, the visualization is what worked best. But there are lots of different types of meditation. And I think it's important to note that meditation is something that's common throughout all sorts of cultures and religious practices. Like prayer is often a form of meditation. There's a lot of different chants. There's a lot of different kind of recitations and stuff like that that can also be considered meditation. So it's something that I think that humanity has found useful for millennia. But again, there's lots of different types of meditation. So like body scan meditation, like breath meditation, there's movement meditation as well. So things like yoga and Tai Chi are like different types of meditation, a lot of breath work meditation, lots of different types of meditation. So whatever your cup of tea is, if you are exploring meditation, you can probably find something that is on the menu that you will enjoy.
I'm going to ask next because I think much to your point of I'm not doing mindfulness right. People, and by people, I mean me and maybe other people, get stuck in I'm not doing it right or I'm not doing it in the right way. So is there a specific place that's better to do guided meditation or a specific way that's better to do it?
Well, again, I think that goes back to the type of meditation that you are going to choose to practice. And so, again, back to your point of doing it wrong or doing it right, one of the ways I liken it to like the guided visualization meditation is going to the gym and having a personal trainer, right? Like right beside you. Versus some other types of meditation might be like going to the gym and like you're choosing your own exercises and going at your own pace. And so there's not one right or wrong. It's just whatever works for you. And so any specific way or place to do it, you can do it at home, you can do it at work. The only caveat I would say is you do not want to be operating a vehicle or heavy equipment while you are meditating. Beyond that, I think you're pretty good to do meditation how you want to do it, where you want to do it. I'd personally like to be lying down, whether in a bed or on a yoga mat or something like that when I'm listening to it. But that's just me.
Stephanie, before I ask you this next question, I will preface it by saying that we are mental health providers, but we do not offer medical advice on this program. But I did want to ask, because I know there's a lot of research out there about the health benefits that meditation can offer. So, can you speak to any of those?
Yeah, so it's actually interesting because as I was doing research for this episode, I started looking at different research and different research articles and some like meta-analysis and stuff like that. And what I found was interesting because a lot of the research around meditation focuses like specifically on mindfulness and doesn't necessarily focus on like guided meditation. And so like for that, I was looking at more like the research around visit, which I'll get into in just a little bit. But the thing I found interesting was that there actually isn't a huge body of research where meditation is concerned. And I think a big part of that is the difficulty in researching meditation when it comes to something that is so like going on in your mind, right? Like, how do you study how effective something is when it's something that is going on in the person's mind? Because there are so many confounding factors. And there's also the placebo effect. And so there is research that shows that mindfulness is helpful, but I also don't want to overstate the effects because meditation should be considered as a complement to other forms of support like therapy, medication, and things like that. If you are really struggling with your mental health, I wouldn't necessarily use meditation as like your sole source of support. But there are definitely benefits that meditation has been found to have, and that includes like stress reduction, anxiety and depression relief, can improve your focus and concentration. You can get better sleep. There's even some physical health benefits that have been found, like reduced blood pressure. It can also help reduce the perception of pain by helping individuals shift their focus and manage their discomfort and just overall well-being. There's one particular study that I found really interesting. Let me pull it up here. It was a 2018 clinical trial funded by the Department of Defense, and it showed that meditation was as effective as prolonged exposure therapy at reducing PTS symptoms and depression in veterans who had experienced combat. So I thought that was a pretty good form of research to demonstrate the effectiveness. But again, it's all very individual, and so the effects that it will have on you depend really on you. And there are lots of different types of meditations. So again, if you are a grad student looking for an area of research, this seems to be an area where a lot more research could be done.
I read a similar article about mindfulness and meditation when I was researching something else about the military and about how I think I talked about this in our last episode, but how it improved working memory because high levels of stress can impact and decrease your working memory, but how daily meditation actually improved the working memory. So I thought that was really interesting. And you kind of touched on this question I have a little bit with the study around PTSD and combat veterans, but are there other symptoms that guided meditation could be beneficial in dealing with, like maybe for someone who has like a depression or anxiety or something else?
Yeah, I think one of the nice things about the guided meditation is that it can be focused on whatever symptoms you are looking to manage. And so you can probably find a guided meditation on a particular thing that you are looking at. I know there's a lot of guided meditations around things like insomnia. There's a lot of guided meditations around like anxiety and panic attack and depression. But there's also things around like grief and loss, chronic pain, addiction, cravings. Like basically, you can probably find a guided meditation on just about anything. And there's so many resources with the internet now. And there's so many different apps like Calm and Headspace. And I know a lot of employers are offering oftentimes subscriptions to those types of apps or even offering their own versions on their websites, which we are going to be doing soon as well. There's a lot of different things that it can tackle.
Some folks may encounter some discomfort or doubt even about engaging in mindfulness meditation. How might you address those concerns to folks who might have some hesitancy about even giving it a try?
Well, first of all, I just want to validate that concern. I think not everything is for everybody, just in the same way that some people are like making the pros and cons about medications. People are making pros and cons about all sorts of things that are beneficial to them and weighing that. So that's totally, totally valid and totally normal. I guess I would just want to approach it with empathy and non-judgment and just ask where they're coming from and maybe addressing common misconceptions. Like many people think like meditation requires clearing your mind completely or sitting still for hours. That's not the case. Again, there's many different types of meditation. It's about finding what works for you. And it's also okay if you try meditation and it doesn't work for you. In going back to the research studies have found like there's not really too many downsides to meditation. Like it's not something that's a practice that's going to be very harmful. The caveat I would say is that if you have patients who are prone to dissociation, meditation has been shown to perhaps exacerbate this, or students, or not students, excuse me, if you have patients prone to depersonalization, similarly. But the research that I saw said that it was mostly around people who are doing like really extensive, long, day-long meditation type of retreats. And so the type of guided meditation that I'm talking about, I have not found anything to say this is potentially harmful in any way. So it's one of those things where it's give it a try. If you don't like it, that's totally fine. If you do, great. It's one more tool in your toolbox. And that's the way I would approach it. Is just this is just one more tool that might work for you. Not all tools work for everybody. You can also encourage people to start with baby steps. Like you're not required to meditate for an hour, right? You can start with 5 minutes, or the meditation that you and Adina have been doing in preparation for this episode was just a 5-minute meditation. Again, it's whatever works for you, whatever fits into your routine, your schedule, and recognizing also that you have to set realistic expectations. This isn't going to be a quick fix. This is something that is a skill that you're training. You're training your brain like you'd train a muscle, and over time it gets easier and more effective. And so you don't have anything to lose by trying it out for a few minutes. If it doesn't work for you, that's okay, but you might be surprised and maybe it will.
That's a great way to describe it. Training a muscle. That's great.
Would you mind defining just disassociation and depersonalization just for anyone listening who maybe has never heard that or isn't sure what it means?
So dissociation is a kind of a broad term that refers to a disconnection between like your thoughts, memories, and surroundings and feelings. People often describe it as feeling like really detached from yourself, being detached from your environment. And so oftentimes it can be a response to trauma. And it oftentimes people describe it as feeling like you're watching yourself in a movie or you're losing like chunks of time, feeling numb. One way I describe it to people who are like not really familiar with it is like a lesser form of dissociation is you ever been driving and you're driving down the highway and you get into your car and then all of a sudden you're at your destination. You're like, how did I get here? I don't remember driving at all. And that's a form of dissociation where you're just like your brain and your body are just really disconnected.
So Jennifer and I are going to listen to a guided meditation that Stephanie has done. And then we are going to, well, you're all going to listen to it because it's going to be at right now. And then afterwards, Jennifer and I will talk about our experience and how we felt about it.
Welcome to this meditation designed to bring you calm and ease. Find a comfortable position, close your eyes gently, and take a deep breath in through your nose and exhale fully through your mouth. Allow yourself to settle into this moment as we journey to a place of peaceful falling snow. Imagine yourself standing in a quiet winter scene. The ground beneath your feet is soft with freshly fallen snow, and a gentle flurry dances through the air. The snow falls slowly, softly, and peacefully, blanketing the world around you in calm. With each breath, feel yourself becoming more grounded, as if the snow around you is insulating you from all worry and tension. Notice the crisp, cool air as you breathe in deeply through your nose. The stillness surrounds you, inviting you to let go of any heavy thoughts, just like snowflakes melting away in the warmth of your breath. Shift your focus to your body. Picture the snowflakes falling gently onto your shoulders, your arms, and your head. With each flake, imagine your body releasing tension and absorbing calm. As the snow covers the landscape, it smooths over the rough edges and quiets the world. Imagine this snow doing the same for you, softening tightness in your muscles, quieting racing thoughts, and creating a serene stillness within you. Bring your attention to your breath. Picture each inhale as if you're breathing in the pure, fresh energy of the snow around you, cool and revitalizing. On each exhale, imagine your worries and fears being carried away like a puff of warm air in the cold. Inhale deeply, feeling the freshness of the snow. Hold and let the stillness settle. And exhale, watching your worries drift away like snowflakes melting in the sun. Repeat this rhythm, feeling lighter with each exhale, as if the snow is creating a protective cocoon of peace around you. Take a moment to bask in this peaceful snowy scene. The falling snow continues to quiet the world, leaving you feeling calm, safe, and refreshed. Repeat to yourself silently, I am still, I am safe, I am calm. When you're ready, imagine the snow melting gently, revealing fresh ground beneath you. Slowly wiggle your fingers and toes, bringing yourself back to the present moment. Take one last deep breath in and exhale fully, carrying this serene stillness with you into the rest of your day. When you're ready, gently open your eyes.
Well, first off, I would like to say that it was a very enjoyable experience. In fact, not that I went into it thinking that it wouldn't be pleasant or beneficial, but I actually enjoyed it. And I think I felt a lot less stressed out, a lot less tension afterwards, well, during and then immediately afterwards. So that was I was surprised at the effectiveness of even just having a few minutes of doing it. I don't want to take all the time on this and give you and Adina an opportunity to share too. But I thought it was also really nice, the language in it to help visualize what was taking place, the snow, and just how that really encaptured all my senses. Because it really helped me get into the moment and actually really feel like I was standing in the midst of some cool, snowy, peaceful scene. So that was really, really nice. Yeah.
Yeah, I agree. I think the language you used really helped me to visualize, which helped me stay out of the what do I need to get at the grocery store mind drifting or whatever. And I felt very relaxed while I was doing it. And I noticed that focusing on how my breathing felt while also focusing on what you were saying, I felt was really very relaxing. And I did, because I had definitely felt like I was doing a lot of stuff in my shoulders and everything were real tense before doing it. And I definitely felt like much more relaxed. And I feel like the rest of the day, I
Mm.
actually felt much more relaxed. So then I thought to myself, maybe I should
Yeah.
pay attention to the sticky note that I wrote saying do a 5-minute meditation in front of my computer and do this every day
Yeah.
because I do feel so much better.
Adina, I don't know if you mentioned the breathing aspect. I don't know if this was similar for you, but on that, it during the meditation, I realized like how shallow my breathing was, and it really made me take like a deeper, slower breath. So that was just something that kind of stuck afterwards too, to maybe be a little bit more mindful that breathing deeply is probably better for me and my nervous system throughout the rest of the day.
I agree. I thought the same thing because I was like, wow, it feels like such a feat to take such a deep breath. How shallow am I breathing all the time that this feels so relaxing, but also almost cleansing, like I've gotten something out.
Yeah. Okay. Well, I was just going to talk about the background music as well. Very light. It wasn't overpowering. I don't know if most guided meditations feature that, but I will definitely be seeking out ones that do, because I think it just helped me get more into the zone. And also maybe even to have a focal point for my brain to also then listen to, right, the guided portion of it. That was really, really pleasant part of it.
So I feel like if I were to do it again, I would probably lay down. I was sitting just like trying to sit relaxed, my feet on the ground or close my eyes. But I feel like I would probably lay down and close my eyes. But I did really like having the visual of the snow because before when I've done, there's some ones on YouTube, they're just like loops of like waves crashing on the shore and like focusing on that visualization, I feel is really helpful. So I really liked, especially with Stephanie describing like a snowy scene and being in it and then being able to look at it almost like I was looking out the window at snow. I feel like that kind of put me all in there.
Yeah. Well, you just brought up the looking out the window and seeing snow. And so I know for you and I, Adina, today we are actually having some snow. And I was curious, right, if I wondered if there's any benefit to doing a guided meditation that maybe also somehow matches your natural environment, or like somehow you could also personally connect to. And if maybe that has the effect of, I don't know, maybe any even deeper experience, right? Because it's one thing like to be maybe on a 90-degree hot summer day and trying to do a snow meditation. I'm sure there's benefits, right? And of course, but to also just have that's just also taking place in the moment while you're also doing this in the moment. Anyway, maybe that's a little too meta, but I was just kind of thinking about that, right? The snow, and then here it is paralleled in the real life too, right? So
Yeah, no, I thought about that yesterday after I did it because I was like, so for anybody not listening who's going to be shocked by this, that I live in the South. And so we're getting snow, and that rarely happens. And so I thought to myself, I could bundle up and I could go sit outside and it'll be cold and I can hear the snow crunching. And then I could listen to it outside while I'm sitting like on my back deck or something. And I bet that would be like a really immersive experience because I'll be able to feel the cold and all that.
Yeah, when I record the meditations that I've been doing, I really have been tailoring them again for myself. And so tailoring them to the season that I'm in. So one of the other things I like doing is like using metaphors like within nature and stuff like that. So when I have one that's coming out that's going to be about, achieving your goals and keeping your focus on a goal. It's like, then that metaphor of getting to the top of a mountain. So like in that guided meditation, we're going to be going on a hike, right? We're going to visualize a hike and getting to the top of that mountain, reaching that goal, right? For spring, I have an idea for one of growth and flowers coming up after the winter and after feeling that coldness of winter and then feeling that warmth of spring and just that growth and like how we grow personally as well and kind of growing towards our own goals. And so, yeah, I like to use those types of things and metaphors. And on a side note, something I did want to mention actually is when I was talking about the research around meditation, there's also a lot of research around visualization, and there's a lot of different therapeutic modalities that use visualization as part of their treatment, and those are very well studied. So sports psychology oftentimes uses visualization to help an athlete achieve their goal. EMDR uses visualization to help a patient find their safe space. CBT uses visualization to help students envision different outcomes. So it's a very well researched tool in that regard. And so this is just putting those visualizations into a meditative format.
Do we have any final thoughts?
Where people can find other things. On the App Store, for whatever service you're using, there are lots of different apps such as Calm and Headspace, I think it's called. There's also lots of free meditations like on Spotify, on Audible. And one of the places where I got meditations way back before the internet was a thing, like, 1999. I mean, I know that existed, but it wasn't the same, was my local library. They had CDs on meditations. And so that's where I got some. People have put out podcasts. You can pretty much find a meditation just about anywhere. If anybody is having difficulty finding some, they can certainly email us and we can point them in the right direction.
Yeah, that's for sure. You can send us an email. I know I found some on YouTube as well. So that's another place to look.
Oh, something else I did want to mention. I know I, for myself, have often listened to meditations that start off like, oh, yeah, okay, this person's voice is okay. And I think I can like this and stuff. And then I'll get like halfway through and then something will just be like really jarring or it just will not sit well or whatever it is. So I strongly encourage people, oftentimes like on YouTube and on Spotify and other places, you can actually see a transcript of what is coming up. So you can just take a quick perusal before you sit down and spend 15 minutes listening to something. Just be like, okay, is this going in the direction that I want it to go? Is this going to cover the symptoms that I want to try and cover? Or is this going to start off okay and then it's going to be half an hour of like deep breathing that is just not personally what I'm looking for? So you can always test things out and check it out that way.
That's a good tip because I've also had that experience where I think I had like a free year membership through my credit card or something for Calm. And so I was like, oh, great, I'm going to start meditating. So I've had that same experience where I started listening to something on the Calm Out app and I'm like, oh, their voice is super annoying or I don't like it or whatever, and then have to find another one. So the transcript is a good one as well.
I've heard too on that. I don't know if you guys have seen on YouTube, there's a few different channels where you can play like soothing, calming music or like brown noise. And for a bit there, I had read an article about folks who are using this one particular provider's brown noise series to fall asleep to. A lot of people will sleep to that. And they were finding that they were not getting very restful sleep. At one point, they would end up having like several nights of nightmares. And then they realized that one of them, like several people were waking up in the middle of the night because the brown noise abruptly shifted to like very scary, like disturbing sounds. Yeah. So there are some nefarious actors out there who may be trying to intermingle healthy things, healthy, helpful, calm things with some maybe not so great comforting noises. So great tip, maybe preview the transcript beforehand so that you are not caught off guard on the internet, because that is surely a place to be caught off guard, I think, for all of us. So be careful out there.
That's so interesting. That to fall asleep, because I used to listen to an ocean. It was like 11 hours of an ocean. It was just the same sound. And so I would listen to that. But now I feel like what gets put on is YouTube videos that are very long about like geography or something else. And it's like literally just someone like very
The
monotone
capital of
talking about
whatever,
like,
and
well, thank you, Stephanie, for being here. If you have not subscribed, please do so. I will put any information about places that we've mentioned or things we've mentioned in the show notes for people that want more information about that. If you have any questions or comments or feedback, or there's a topic you'd like us to cover, you can email us at dhbhs.media@hitchcock.org. And thank you so much for being here, Stephanie, and we appreciate you listening.